Today is Wednesday, April 8th. Good afternoon and welcome to the COVID-19 Task Force Daily Update. Some good news to start off the program today, and joining us to give you that news is Ietsenhaienhs, Gina Deer from the Mohawk Council of Kahnawake. Gina?
This is take two. So I am very pleased to be here today to announce that there is a donation that was made by Mohawk Online in the amount of $1 million to the Economic Relief Measures Fund. We are very pleased to have a $10 million fund. We realize it sounds like a great deal of money. In the grander scheme of things, though, we realize that the monies will go fast. Today was the first day that checks were issued for individuals. There were over 300 checks that were issued and the amount of $444,000. We have finally finalized the applications for the businesses. That will start to get underway as soon as tomorrow. We are hoping that checks will be going out, if not tomorrow, by early next week. There are 120 businesses that have called. Out of the 120 businesses, 112 have completed surveys to try and gauge what the needs are for the local businesses. We, from Mohawk Council, realize that the $10 million will go quickly. We are hoping that this will be a 90-day fund that we can utilize, and then we have to reassess. So as we continue progressing with the checks, we will update the community through our webpage. So again, Mohawk Online has added another $1 million to the fund, and we have a total of $10 million. Yawa.
Well, it's good to get some good news in these very difficult times. Gina. Joining us now is our Chief Peacekeeper, Dwayne Zacharie. Dwayne will have an update for us as we are now in our third week of this COVID-19 pandemic. Dwayne?
Good afternoon, Kahnawake. I just wanted to do a brief update. So over the last couple of weeks, I've had the opportunity to come up here and address you on different issues that are plaguing our community in relation to COVID-19. And over the last few weeks, I've had the opportunity to speak to a number of you, and you've given me the pros and cons of my updates. So today I'm going to tone it down a bit and just say, listen, Kahnawake, I appreciate all the good work that you're doing. The task force is working very hard for you and your safety and your security, but you know, we can put in as many directives and measures as we want, but without the cooperation of our community, it makes it very difficult for us to be successful. So I wanted to say to all of you out there, good job, keep it up, continue to do what you're doing. Some of the issues that are plaguing us now, driving habits. I talked about that a couple of episodes ago. We need people to follow the rules, right? Rules of the road. It's vital, it's important. We don't want anyone to get injured. We're dealing with enough in relation to COVID-19. I know lots of people are out there, right? The weather is going to start to get really nice. People want to be outside, of course, practicing social distancing. That's vital. But listen, everyone driving a motor vehicle, you have to be aware that lots of people are on the road. So be aware, be cognizant of that fact. Drive safely, follow the rules of the road, please. Also, we've taken a huge number of calls lately about four-wheelers, ATVs, side-by-sides. We have lots of calls about youth driving these, really young kids, right? They shouldn't be. That's a no-no. Please don't allow it. We have lots of calls about people driving those vehicles without helmets, driving on the roadways all hours of the night, speeding. Please don't do that. We're going to have to deal with it. And we have lots of other things to deal with, so we're asking for your cooperation. Please stay off of our roadways with those. They're not supposed to be on there anyway. We need your cooperation. It's vital. We take lots and lots of calls every single day about non-locals in the territory. Please continue to give us those calls. It's important. We're dealing with that every single day. We have lots of calls coming in, so we want to make sure that all of you within the territory are safe and secure, and we need your cooperation. Please don't intervene. Call us, and we'll send a car as soon as we can to get there to deal with the issue, okay? So please call us. Continue to call us. I know throughout today, Ajay Foot was out there doing lots of work in relation to the signs, right? So if you go around the community and drive around, you'll see some changes to our roadways. There are signs that are out there. I believe today there were 19 signs that were installed. Some of them were talking about access to the Mercier Bridge only, right? Do not come into the territory. And then there were some other signs that were posted that say residents only. And all of them say on the signs that fines could be levied. So please call us. We're doing all of these things. We're putting all these measures into place for your safety and security. I'll go back to my message at the beginning. We want you all to be safe. Listen to the measures. Listen to the directives. We need your help and we need your cooperation. So stay safe. Nyawa.
Nyawa, Dwayne. And I think it's a good idea if people have a chance to check out Kahnawake.com. There are several press releases from today, including the one that explains the sign situation. And it's probably best if you just read through it. And it really does explain, because some people are very concerned that we perhaps even look like we're racists, or saying, you know, we just don't want non-natives here. It's all about the consistent messaging we've had all along. So again, if you get a chance to look out there, look at Kahnawake.com. There are at least 5 press releases that went out today. It was a very busy day. And speaking of busy, our Commissioner of Public Safety, Lloyd Phillips, is here, the busiest man in town, and he's here to give you his daily update. Lloyd?
Once again, thank you, Joe, Gina, Dwayne, for coming on and giving your brief but very important updates to the community, and basically informing the community, as well as you know, providing some information that's vital to the community. As Dwayne mentioned, there's a series of signs that have been placed around the community. That was done throughout the day today. You'll see some pictures here up on the screen that shows the signs being installed, and they will continue putting even more signs tomorrow to again make it clear on what the intent here is, to ensure that the non-locals, the people who don't work in the community, understand that at this point, you know, Kahnawake is for residents only. So that's some work that's ongoing, and I'm sure you'll notice those signs if you take a ride around our community, as well as there's other signs that are smaller, which will be going along any access point off of 132, 138, or 207, and OCR that leads to a residential area. We had a task force meeting this afternoon. Again, very, very fruitful discussion, some good updates on the status of the community, and again, preparing for, I guess, the next phase of dealing with the pandemic, and I'll touch on that in just a minute. But 2 other points in that. I'm glad today, for the first time, we had representation from the Longhouse on 207, who were participating in the meeting, as well as we had a representative from the Mohawk Trail Longhouse. So we certainly welcome them along. I'm sure they'll provide some valuable insight and help guide us over the next several weeks as we deal with this pandemic in our community. As well, the Grand Chief Joe Norton did meet with representatives from the mayors in the region of the MRC, they call it, the Montérégie region, and they reached out back to the task force and to council, and basically saying that whatever assistance that they need from us, you know, they're willing to assist us, and want to work collaboratively with Kahnawake. So I'll be speaking with them tomorrow. But our main message that we want them to start delivering to their citizens is basically to reinforce what we've already been saying, is that, you know, Kahnawake is for residents only. and please, if you must pass through Kahnawake, stay on the main highways, go over the bridge, go to the city, go where you gotta go, but please leave the residential areas for Kahnawake only. So I'll be speaking with her tomorrow and making sure that message gets out on whatever means they have possible on their side to spread that message. Today, another, I guess, sort of milestone within Quebec. First time the positive cases of tests surpassed the 10,000 mark. So it's certainly a new phase in the ongoing, I guess, ongoing pandemic and the ongoing evolution of what's taking place. But more importantly, as some of you may have seen, that the Quebec government released some projections on what could be expected in the next month within the province of Quebec, and also obviously those numbers and that projection includes our community, because obviously our neighbors are next door. We can't get away from that part. And also, as we know, that the virus is already in and around the community. So what they had put forward are some numbers that may seem a little daunting, a little scary to some people, and I want to explain just a little bit what they came from and how they came to these numbers. First of all, these numbers and projections are based upon what happened in Europe, countries who have been dealing with the pandemic for a number of weeks and months. Some have done relatively well or very well in coping with the pandemic, and others have done had a much harder time and had major consequences. So as we know, in Italy are one of the worst case scenarios that happened, with the amount of people who contracted the virus and obviously the number of people who died from it. That's one of the worst case scenarios. But then if you look at other European countries such as Portugal and Germany, where they had a different approach, a different way of dealing with it, were more proactive, and they certainly had their impacts, but they're much better able to cope with the pandemic and minimize impacts on their country. So those were looked at, some of those examples on what worked and didn't work in Italy, and what worked and didn't work in Portugal and Germany, and look at how that progressed, and how that when it came across the Atlantic, so to speak, it came into North America. And now what's happening in the U.S., in New York City and other places, what's happening throughout Canada, and what's happening in the province. So all these factors were put into place to take a good hard look at what are we really looking towards moving forward. And some of the numbers they projected are quite alarming, to be honest with you. If you look at the worst case scenario, like an Italy type of scenario, Quebec is projecting the possibility up to 8,860 deaths from COVID-19 by the end of April. That's the worst case scenario. On the other side, they're saying what would be more of a very optimistic and more of a best case scenario. Some of the numbers are still a little bit daunting. Best case scenario, they're looking at the numbers from now until the end of April to have the amount of 1,263 people dying from the COVID-19 virus. So, these are numbers that can be managed to a certain extent. We do have some control as a community, even larger, the province and the country. We do have some control over these numbers. And a lot of that control rests with you as the individuals. Because like I said before, your actions, are never more important to the collective than they are now. Obey by the directives that were put forward, and the basics of keeping your physical distancing or social distancing, staying home for only as much as humanly possible, no essential services only if you have to go outside, washing your hands, those types of things are they may sound simplistic to some people, but they're very crucial in a time like this, because if you look at these numbers, it could be somewhat daunting to say anywhere between 8,880 people or 8,860 people down to 1,260 people. That's a very large gap. But at the minimum, you're looking at in the province of having 1,260 deaths is still way too many people. So our actions that we do will certainly help keep that number as close to the optimistic number as we possibly can. And with that said, there's also the reason behind that is, they're expecting, because of now that we talked about before, the community transmission, where basically the community spread, where it's going from person to person and you can't really trace where it originated from, as well as the first wave of people who got the virus. They're expecting a second wave, which is really going to be larger than the first wave. So right now we're on the beginning of the wave, and we're expecting a larger wave to come. I say this again to be as frank and honest with the community, to prepare ourselves, because we have to keep these measures in place and be strong, because we have to be prepared. The wave will come. It may hit us hard, it may hit us fast, but hopefully as it hit us hard and hit us fast, and it'll pass as quickly as possible. So the stronger we are as a community, the faster, hopefully we'll get through this as unscathed as we possibly can. And with that, they're looking at numbers as well in terms of the peak. They're looking at in and around April 18th we should reach that peak. Remember talking about the curve for many times now. Around the 18th of April, they're looking at reaching that peak, and at some point then start leveling off for a while. We'll be in the midst of that big wave before it starts to gradually drop off, and things start to get better as we keep time goes on. So that may be somewhat of a somber note, but again, we're trying to be transparent and clear as possible, and Lisa will speak a little more about this in just a minute. But these are the rationale and reasons why we have a task force, and the reason why we're taking these measures. And the measures taken for the past 3 weeks, and even some as of today with the signage and stuff, we're getting mixed messages from our community. Some people feel that the measures we're taking are too strict, or they're too extreme, they're too limited in your freedoms. Where others feel it's the opposite. They feel we're not doing enough, and we should do. One email I got today was a total lockdown of the community, and so there's different spectrums of people out there, and I think the task force is doing a good job of finding the middle ground there, of being proactive enough, being strong enough to protect the community without having to go through either extreme of what is required. So I'll be back after Lisa speaks, but just think about that, because like Dwayne said, we all live here. We're trying to find the best way through this, and we're going to make the decisions that are best suited for Kahnawake. Yeah.
Now, Lloyd, just a note here, while I'm here, we've been, of course, continuing to wash our hands every time we're up here, trying to just be better role models as well. We got some supplies from one of the local places, some alcohol, so to help us out. So we'll be talking about that next time out. And so there are some good things that are happening, and lots of people are staying the course. So do what you can. Joining us, as she has for most of these programs, is Lisa Westaway, the Executive Director at the Zacharie Memorial Hospital Center. Lisa?
Hi, good afternoon. Lloyd explained it very well, so I don't have very much to add. I wanted just to explain that those projections that Legault made yesterday are, yes, they're based on evidence and observation of what's happening in other countries, but they're linking that with what's happening now here, with the waves that we've seen, with the timing of our spring break, with the amount of positive cases and our ascent on that curve. So there are experts and mathematicians who are doing those projections. So those are real numbers that we are expecting before April 30th, and therefore there is much that will happen between now and then that we need to be prepared for. So yesterday we talked about how well we're doing. We're not taking that away from our community. We are doing extremely well, and with respect to our elders, we spoke about it today with our staff of how proud we are of the work that we've done and how we've kept everyone safe up till now, but we continue to prepare for what may happen in the future, and we're asking you to do the same, because as much as we're doing well, if we don't continue, that will make the difference in how this may play out. And again, it's not any one person's fault or responsibility. This is a collective. This is all of us working together in unison, following the measures that are being implemented. And the next few weeks, and we keep saying that the next few weeks are going to be the most difficult weeks. And we have to keep working hard. We have to be prepared for what may come. And the better prepared we are, this is why the ministry does projections. It's actually to be able to prepare so that we can meet whatever happens as much as possible. So for example, I had mentioned about creating hot and cold spaces within the hospital. So if we do have a positive case, we're ready, we're prepared, we can move people so that we're securing our site as much as possible. That's an example of being prepared. We can be prepared with needs for human resources, for protective equipment. The ministry does projections so that they can be prepared for how many beds they might need in the province. Their worst case scenario right now is almost 2,000 beds more than what they have. So if they hit their worst case scenario, they need to be prepared for that. So projections are really important in order to prepare a society for what may come. And that's what we're doing as well here at the task force, so that we can try to mitigate as much as possible the damage that may be done as we move forward over the next few weeks. So Lloyd talked about it, the importance of continuing measures, and the most important ones are ones that we have full control over. Hand washing, hygiene, meaning sneezing into your arm, washing your surfaces, also self-isolation. So just a little comment about that. Somebody who has been tested, who has had contact with a positive case, or who has traveled and has tested negative, you are still asked to self-isolate for your 14 days, even if you've received a negative result, because we have seen that people over time could become positive. So when you're asked to self-isolate for 14 days, it's a full 14 days. Now somebody, and I know this gets complicated, but somebody who has no contact history or travel and develops cold symptoms and then is tested and receives a negative, well, the self-isolation for 14 days is not as critical, except what is critical is physical distancing, so keeping 2 meters apart at all times. If you leave the house, you need to keep up your physical distancing. So we have cases that have been positive in the community and that have completed their their time and you know, it's been publicized very openly by many that they're able to now, you know, go out and that they're not a risk, and that's true. But those people have to also still maintain their physical distancing. So, and I spoke with public health just before coming on today about that particular issue and how it's become a little bit of a misinformation across the board of how those who have recovered no longer have to do their physical distancing. They still do. Now you might ask questions, well, why then are people able to come back into the healthcare system? We have extra requirements for the healthcare system, as we've mentioned. We have to actually do 2 negative tests before you could come back into the healthcare system. And the reason for that is because sometimes we cannot maintain that 2-meter distance when we're intervening with one of our patients. And so we have extra precautions in place for those situations. But physical distancing is extremely important at all times. All the measures that we've implemented, we have no choice but to maintain them for the next few weeks until we get through this wave and see where that brings us. We have to really, really remain diligent. Again, we're thankful and grateful of all the hard work that we've been doing up till now, but these projections really reinforce the fact that we have to continue. So we're going to continue to remind you and bring up these measures on a day-to-day basis until we get past this crucial period, and we wish you all to stay safe. Thank you.
Thank you, Lisa. Well, with the potential of thousands dying over the next several weeks across the province, I think, you know, that reemphasizes the fact of reason why we have to take these strong measures. You know, and I hope some of these numbers, you know, and you know, may seem, you know, somber and stuff, but for those people who may not be taking it seriously, understand the severity of what we are actually dealing with here. Again, the task force is here to do what we got to do to ensure safety and security of our community. It's not about one person. It's not about one business. No, it's not about me or you. It's about everybody. So that's how we've been moving forward, and that's how we're going to continue to move forward. And one thing, I heard a good statement made by a physician on TV the other day, and he says, you know, the virus doesn't move unless we move. So please, people, stay home. Voilà.